So Gummy smiles. What are the treatment options?
The treatment options are actually, from my standpoint, pretty simple, but they're very dramatic for the patient.
So what defines a gummy smile?
A gummy smile is basically someone who is not able to display the full length of their front teeth because they have just too much gum tissue. Sometimes a little too much bone, that we do see that from time to time. Often happens with orthodontic patients. Younger orthodontic patients have a tendency to grow some extra tissue. Everybody in the office loves these surgeries because they are absolutely transforming to the patient. We simply go in with a combination of either using the laser, or if there's a lot of tissue, we will have to use conventional and laser together. But what we do is we expose their natural tooth length, and it is instantly transforming for patients. We had one teenager, best described, I'd call her the typical moody, kind of glum 16-year-old. And halfway through the surgery, and some people don't like to do this, but when I'm half done, I'll give them a mirror so they can see what we're doing. And in an instant, she started becoming a different person.
Wow.
3 weeks later, her parents came in and with her at a post-op, and at her post-op she's dressed, her hair's done, she's conversant, and they said her personal relationships have changed, her school relationships have changed. I mean, it totally remade her.
Because now she likes her
smile. Because now she likes her smile, and that's how powerful that, particularly at that age, of course, as we all can appreciate,
so
from our
age,
past.
I mean, somebody,
but at any age.
60, 70s, it
60,
doesn't matter. If you
doesn't
have a
matter.
gummy smile.
Yeah, I've done the procedure on 60-year-olds, and they just have a hoot with it. They think it's the funnest thing because people are always asking them, did you do your hair? Did you dye your hair? Did you lose weight? Did you?
Okay.
Nobody ever notices that it's the teeth that have changed, but there's this, and we have stories, my staff keeps the stories in a box. It's just amazing what people will tell us about it. But
so you do it with a laser? You do it combination therapy?
You can do it with combination therapy. The one thing about the laser is that you have to be careful with the laser getting too close to bone. Okay. And so when we have people who have the combination problem of a little too much tissue, a little too much bone, we have to use some conventional therapy, but we are always finishing it up with the laser, and that's what matters. It's what you finish with. It's not what you start with. Okay. So you get the benefits of the laser as far as pain reduction, swelling reduction, faster healing, but in those special cases, we do have to do a little conventional work.